Hello and welcome to Outreach 300, which covers entry and contacts, as well as service transactions. I am your trainer, HMIS System Lead Trisha Cano. In this session, I will be demonstrating how to create an entry and record your first contact with an outreach client, how to record subsequent contacts, and how to record any services that may have been provided during these contacts. Please note that if you have any questions, please feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log on to HMIS or a service point, for most outreach teams, you are required to get into Enter Data As mode. How to get into Enter Data As mode was covered in HMIS 100. So go to the upper right-hand corner and click on the link Enter Data As and choose the outreach project that you're going to work in today. For training purposes today, I'm going to pretend that I work at H3 Chandler Outreach, which is the Community Bridges Outreach Project. So I'm going to choose it by clicking the green plus sign. And now I am in Enter Data As mode to the actual outreach project. Next, determine if you need to use backdate mode. If you're entering a contact or a service that was conducted with the client today, it is not necessary to use backdate mode. But if you're entering in something that happened a few days ago or yesterday, then you should use backdate. The backdate link is on the upper right-hand corner right underneath Enter Data As. And we will backdate for training purposes today. Please keep in mind that the HMIS data quality plan says that all information about a client must be entered into HMIS within 5 business days of the interaction. For training today, though, I'm going to go way back in time so we can show a progression of this pretend client. So I'm going to go back to March 1st, 2015, and then you click Set Backdate. Once you're in backdate mode, your banner turns bright yellow as a reminder. And now I'm going to look for the client that I had contacted. Keep in mind, right now I'm talking about a first contact, the very first time you meet someone out on the streets or wherever it is you're making your contacts with potential clients. And so you're entering them into the system for the very first time. Go to the left-hand side of your screen to the menu and locate the Client Point module and click on it. And we're going to search for our client in HMIS to see if they already have a record started. So I'm going to search for a pretend client, obviously. Put in the name data quality. Are you reporting their full name, a partial name, or a street name? Client doesn't know, client refused, data not collected. This is usually either you have their full name or you have like a partial name or a street name. I'm just going to say full name reported for today. Put in their social security number if you have it. Now obviously an outreach team, it would be very rare for you to have a social security number at first contact. So I'm going to choose that the client refused to give it to me at this time because I haven't even asked for it yet. And then finally, is the client a U.S. military veteran? If you know the answer to this, say yes or no. If you haven't gotten that information from your outreach client yet, then say client refused. Now click on the search button to search and see if this client is already in the system. If they were in the system, a list of names would populate underneath under client results. This will populate a list of names that are similar to the client you're looking for. The name won't always be exactly what you're looking for, and that's what you want. If your client that you were looking for in the system shows up on the list below, then just click on their name to select them. Do not create a duplicate client if you can avoid it. But in this case, for training purposes today, I'm going to pretend that this client has never been in the HMIS system before, and so I'm going to click Add New Client with this information. And it just wants me to confirm that I really searched diligently for the client, and I did, so I will click OK. Once you click OK, the client's HMIS record opens. I'm going to go over the client record and what all the tabs and different boxes mean before I get into the training of how to actually enter your outreach client into the system for the first time. So let me switch over and let's talk about all the different boxes. The very first tab that you're on, the default tab when you open up your client record, is the Client Profile tab. Some of the things that are located on here is the client record, where you can edit their name, their social security number, and their U.S. military veteran status. Please keep in mind that the U.S. military veteran status can be answered either from the client search screen or from the client record on the client profile screen. You have client demographics. This is blank because we have not done an assessment yet. Please do not ever try to fill in your client demographics from this window. This should be done from the Assessment tab, and once we do the assessment and save it, this information will populate. You can add a client picture if you have one. This is where you can add your AZ client notes if applicable. Do not ever use just plain client notes. Use the one that says AZ client notes, please. It's where you can add file attachments and you can add an incident if necessary. Now, some of the other tabs located on the client record is the Households tab. This is used when you're dealing with a family grouping, or a couple. This is very rarely used in outreach, so I'm not going to cover it today. If for some reason you do encounter a family out on the streets, please contact the HMIS Help Desk and we will assist you in how to set up a household. Next to Household is the ROI tab, which stands for Release of Information. This tab is not used in Maricopa County. That is not to say that you do not get releases of information for your clients when applicable. You do. You just don't enter them on this tab. Next, we have the Entry/Exit tab, and this is what tab that we will be using today to create our initial contact with the client and subsequent contacts. We have the Case Managers tab. This is where you can add yourself as the client's case manager. This is covered more in the Case Management 200 series. The Case Plans tab, this is where you can add an electronic case plan, service plan, treatment plan, whatever your agency calls it. This is covered more again in the Case Management 200 series. And then finally over here we have the Assessments tab. The only thing this tab is used for at this time is AZ Client Notes. Please do not ever actually fill out an assessment from this tab. All assessments are completed through the Entry/Exit tab. And behind the Entry/Exit tab is the Service Transactions tab. And we will cover this a little bit later in the training, but we will talk about how to add a service on a client that you were working with. So let's go back to the client information side of the client record and back to the client profile, and this is where we started. Okay, so now we are ready to record our first contact with the client, and that means we need to create an entry. So once you're on the client record that you've either created or searched for, go to the Entry/Exit tab, and you're going to click on the Add an Entry button. You may see other lines of entry into other projects the client may have been served by in the HMIS system. But still, you would click the Add a New Entry button. Please ensure that the provider is correct, that it is your outreach project. If this is not the correct provider, that means you're not in Enter Data As mode, and you need to cancel and get into Enter Data As mode first. Next, you'll choose the type of HUD. You will always choose HUD. And ensure that your entry date is correct. If this is not the correct entry date, then you're not in backdate mode, and you need to cancel and get into backdate mode first. Once you ensure that these three items are correct, click Save and Continue. And this will open the Entry/Exit data screen on your client. The default assessment is the Outreach Universal Contact Assessment. This assessment asks for just some basic demographic information about your client and for you to record the date that the contact happened. So let's fill out the date of birth. If you did not get the actual date of birth during this first contact with your client, you can put in an approximate date of birth based on how old you think the client is, or if they told you how old they are. So I'm going to put in a pretend date of birth, and I'm going to say it's approximate. If the client did give you their actual date of birth, you would put full date of birth reported. Primary race. So what is my client's race? American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, or data not collected. If you're not sure what these 5 categories mean, you can hover on the question primary race and read the HUD definition of what these mean. Next, we have secondary race. Please only complete this question if the client reports a secondary race. If they do not report a secondary race, leave it at select. Do not record the primary race twice. Then we have ethnicity, non-Hispanic, non-Latino, or Hispanic Latino. If you're not sure what this means, again, you can hover on the question ethnicity and it will explain what that means. If your client does report of being Hispanic or Latino descent, then you should record their race as white according to HUD. Then we have gender, female, male, transgender male to female, transgender female to male, other, or data not collected. If your client reports a gender that is not on this list, you can choose other, but be sure to type in what that other gender is in the text field below. And then we have date of contact. This is very important. Every single time you have a contact with your client until they reach the engagement point, you should record that contact on this sub-assessment. Click the Add button and put the date the contact happened. You can use the shortcut here, the calendar with the green check mark, and it will set it to our backdate date. The location, place not meant for habitation, service setting non-residential, service setting residential. These mean non-residential could be like a drop-in center or a soup kitchen, someplace that just serves food but doesn't allow clients to stay overnight. A service setting residential could be like an emergency shelter. But I'm going to put place not meant for habitation and save. So I've recorded my very first contact within the entry, which is the same day as my first contact. Now, according to the Maricopa Continuum of Care Data Quality Plan, outreach projects are not required to collect more data than this at this point. We understand that it takes time to build a relationship and a rapport with people that you're outreaching to on the streets. The expectation is that you collect as much data as possible during every contact and you slowly build the client record as you go until you get to the point of engagement. And at the point of engagement, that is when the expectation comes into place that you would complete every question on the assessment. And we will talk about that more in the Outreach 301 class. But for training purposes today, I'm going to pretend that the client gave me a lot more information than just this, and I'm going to show you how to fill out that assessment. So I'm going to click Save to save the data I've entered so far. And I'm going to go up here to the Select an Assessment area, and I'm going to switch to the Maricopa UDE assessment. UDE stands for the Universal Data Elements. And I'm going to fill in some more questions. Again, this is not required at first contact. This is something that you would build the record and acquire over time, but I'm going to show you how to answer these questions today. So once you get past these basic demographics that are required because they're in bold, then you have, does the client have a disabling condition? Yes, no, client doesn't know, client refused, data not collected. If you're not sure what disabling condition means, you can hover on the question and read the HUD definition. For training purposes today, I'm going to say, yes, my client reported a disabling condition. The next question is residence prior to project entry, or in our case, residence prior to my contact with this client. So this means, where did my client sleep the night before I made contact with them? Emergency shelter, foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, hotel or motel paid for without an emergency shelter voucher, jail, prison, or juvenile detention facility, long-term care facility or nursing home, owned by the client, no ongoing housing subsidy, owned by the client with ongoing housing subsidy, permanent housing for formerly homeless persons, this means permanent supportive housing, place not meant for habitation. This is what I'm going to choose today, but I'm going to go ahead and explain the rest of the options to you. Psychiatric hospital or other psychiatric facility, a rental by client with no ongoing housing subsidy, a rental by client with VASH subsidy, this is Veteran Administration Supportive Housing, rental by client with GPD TIP subsidy, this is another VA program, stands for Grant Per Diem Transition in Place, rental by client with other ongoing housing subsidy, and this could be things like rapid rehousing or Section 8. Residential project or halfway house with no homeless criteria, a safe haven, there's only one safe haven in Maricopa County, staying or living in a family member's room, apartment, or house, staying or living in a friend's room, apartment, or house, substance abuse treatment facility or detox center, transitional housing for homeless persons, including homeless youth, other, client to know, client refused, data not collected. If you choose other, again, be sure to specify what that other residence is in the text field directly underneath. Keep in mind, the other option should be used very rarely because this is a very comprehensive list of residences. So I'm going to choose place not meant for habitation. Then I have length of stay in previous place. This question is indented, which means it applies to the question directly above it. So what this is asking is, whatever you chose for residence prior to project entry, in this case, place not meant for habitation, how long have they been in that residence, or non-residence in this case? Your options are 1 day or less, 2 days to 1 week, more than 1 week but less than 1 month, 1 to 3 months, more than 3 months but less than 1 year, 1 year or longer, client doesn't know, client refused, or data not collected. So I'm going to say my client has been on the streets 1 year or longer. The next question is zip code of last permanent address. This means, where was the last place your client actually resided for 90 days or more in housing? If the client does not remember the zip code of the last place that they lived for 90 days or more, you can usually get them to tell you the town or city that they were living in. And in that case, if you hover on zip code of last permanent address, we give you some zip codes that you can use depending on the city that they report to you. This list is the major cities in Maricopa County, and at the bottom of the list, you can see if they were living outside Maricopa County or in another state. If they don't know the zip code, you can use this generic zip code. I'm going to say they were in Surprise. Relationship to head of household, this is another required question because it's bold, and it's going to be self because this is an individual. Client location, this question must be completed for all individuals, and you can't get it wrong unless you don't answer it because there's only one option on the pick list. This is our continuum of care code for Maricopa County. Homelessness primary reason. What's the reason that they report to you that they've ended up homeless? They've aged out of foster care. Client doesn't know. Client not homeless. This is used by homeless prevention projects. Client refused, criminal activity, data not collected, domestic violence, economic, evicted, family dispute, overcrowding, loss of job, medical condition, mental health, moved to seek work, natural disaster or fire, released from jail or prison, relocated, substance abuse, and trafficking exploitation. I'm going to say released from jail or prison. If you're not sure what trafficking exploitation means, you can hover on the question homelessness primary reason, and we've given you the federal definition.
Length of time on street in an emergency shelter or safe haven. These set of questions, along with other questions in the assessment, will help you determine if your client is chronically homeless. Please answer these questions on all heads of households and adults. Let's go over to the first question. Client entering from the streets, ES or SH? To the right, answer from the pick list, yes or no. Answer yes if the client is entering your project directly from a place not meant for habitation, an emergency shelter, or safe haven. Answer no if the client entering your project from any other location. Diversion and homeless prevention projects should choose no. So for this scenario, I'm going to choose yes. Answer the next question if yes for clients entering from streets, ES or SH, approximate date. If your client is coming from the streets, ES or SH, you should have the client look back to the last time the client was not on the street, ES or SH. I'm going to give you a few guidelines, you can call them rules, to answer some of these questions. If there was a break in their time on street, ES or SH, of less than 7 nights, do not count it as a break. It would be one continuous episode of homelessness. If the client experienced a break for more than 7 nights, count a break in between episodes. If a break in time was 90 days or less due to an institutional stay, such as jail, substance abuse or mental health treatment facility, hospital, or any other similar facility, that time should be included in the start date time. If the client was at an institutional stay for longer than 90 days, they're considered to be housed. If the client knows the month that the homelessness started, but not the exact day, use the day they're entering from your project with the month and year that they reported, because this is self-reported information. Documents in HMIS may be used only to jog the memory of the client, but cannot be substituted for information they provided directly to you. If the answer above was no, then just leave this question blank. So for this scenario, I'm going to say 10/9 of 2014. Next question. Regardless of where they stayed last night, number of times the client has been homeless on street in ES or SH in the past 3 years, including today. So please record appropriate answer for number of times the homelessness experience in the past 3 years for any combination of place not meant for habitation, emergency shelter, or safe haven. When counting episodes, please use the guidelines and the rules that I explained previously. Never in the past 3 years should be used for diversion or homeless prevention projects only. So from this pick list, you would choose never in 3 years, 1 time, 2 times, 3 times, 4 or more times. So for this scenario, I'm going to say 2 times. Total number of months homeless in streets in ES or SH in the past 3 years. So from this pick list, you would count the accumulated number of months a client was homeless and residing in one or any combination of these 3 locations in the past 3 years. Please note, any single day or part of a month spent homeless should be counted as 1 full month. So if it's more than 12 months, you don't have to calculate anything more than that. You would just put in more than 12 months. So I'm going to choose more than 12 months for this scenario. Then we have length of time homelessness, status documented. To answer this question, yes or no, indicate if there is documentation of the client's length of homelessness, either in the client's paper file or in HMIS for either the number of times homeless or number of months homeless in the past 3 years. So this is asking for proof. So you can answer it either yes or no. I'm going to answer it yes for this scenario.
And click Save to save your answers, and save and exit. And now we have created the entry as well as the initial contact with our outreach client. The next thing I'm going to show you during this training is how to record any subsequent contacts. It's very normal for when you're outreaching with clients that it would take more than one contact to reach the state of engagement. So I'm going to show you how to do that. And every single contact with a client should be recorded in HMIS, and you should follow the workflow that I'm about to show you. So I'm going to pretend like a week went by, and my first contact with the client was on March 1st. So I'm going to say that it's March 8th, and I'm about to have another encounter with my client. So I would look up my client in the system, right? And then I'm going to record another contact. So I am going to go to the Entry Exit tab, but I'm not going to create another entry. They already have an entry that we created when we did their very first contact. What I want to do now is I want to update the entry that's already been created and record my next contact date with this client. And this is done by finding your line of entry and going all the way to the right-hand side of the screen and locating the Interims column. Once you locate the Interims column, you're going to click on this Interim Reviews link. Click Add an Interim Review and select your interim review type, which is going to be an update. I'm updating this client record to show that I've had another contact with them, and my update date is March 8th. Click Save and Continue. Just like before, the Outreach Universal Contact Assessment defaults open, and I can scroll down here to the bottom and locate my Outreach Sub-Assessment and now record my next contact. Click Add again, put in your new date, where did you have the contact at, what was the location, and save. And now I have recorded 2 contacts with my client. As we stated earlier, if you hadn't gathered all of their information during the first contact, but you gathered a little bit more this time around, you could switch to the Maricopa UDE assessment and start filling that out. I'm going to click Save and Exit, and then exit from here, and I have recorded a second contact with my client. And you can see it gives me a little warning on my Interim Updates link that I have 1 update done. 1 update plus 1 entry is 2 contacts. Let's do another one just for practice, and then I'm going to show you how to record services. So let's say a couple weeks went by, and now it's April 2nd. I would search for my client through the Client Point module, go to their Entry Exit tab on their record, find their entry into my outreach project, and create another update by clicking the Interims link. I'm going to add another update. I'm not going to edit the one that's there. This is a brand new one. And I'm going to go to the bottom and I'm going to add another date of contact. These dates of contacts are very important for reporting purposes. So I have another date on April 2nd, still a place not meant for habitation, save and exit. And now I have recorded 3 contacts with my client. Now let's say during this most recent contact that I had with my client on April 2nd, they told me that they are a veteran. And I need to update that on their record now. So I could go over here to the client profile, since their record's already created, And I can edit their client record by clicking on this little pencil next to the word client record to change their U.S. military veteran question from client refused to a yes, and then click Save. And it's as easy as that to update their record. The next thing I'm going to show you is how to record a service. It's really important to record a service whenever you provide one to the client. And when we get in there and look at the list, you'll get an idea of what that means. So when you're on the client record, and I'm just going to go ahead and stay in the backdate mode of April 2nd, here's how you record a service. Find the Service Transactions tab behind Entry, Exit, and click on it. And there are multiple ways to record services, and I'm going to show you each way. But the first one I'm going to show you is how to record one service for one client, and that's our training client today. So I'm going to click the button that says Add Service. My provider defaults. If this provider is incorrect, that means you're not in Enter Data As mode, and you should cancel and get into EDA mode first. Your start date and your end date. The start date always fills in automatically. If for some reason your end date does not fill in automatically, please be sure to end the service. All service must have an end date the same day as the start date. Do not leave a service open. And then what kind of service did you provide for the client? Now this list of services is custom to every agency and project, and so your list may look different from this list. If there's something that you provide and it's not on the list, please talk to your supervisor or the HMIS help desk about adding more options to your list. So for training purposes today, I'm just going to choose something generic. I'm going to say I referred my client to a food pantry. They needed food. So you do provider, start and end date of the service, and what did you provide to them this day. Then click the Save and Continue button in the lower right-hand corner, and it opens up the next page to the services. Next, you have service costs. This section is optional for some agencies. It is not necessary always to fill it in. Most outreach teams are not required to fill in anything to do with the service costs or how many you gave them. Oh, and right above this where it says service notes, this is where you can put a small note about the service that was provided. This should be short. It should be a few words, a sentence. If you need to write a note about all your interactions with this client and what happened, you should use AZ Client Notes. This is not meant to be a progress note on the client. This is just meant for a quick note about this particular service. And there's all this information about services because many different types of agencies and projects use the Service Transactions tab. Some people have to record their funding source and supporting documentation, but that is not required for an outreach team. So just go ahead and scroll to the very bottom of the page to where it says Need Information. And we are required to fill in the need status and the outcome of the need. So what this means is the client had a need for food, and we provided them either with food or where they could go to receive food. So our status is going to change from identified to closed because they needed it and we provided it. And the outcome of the need is fully met. Doesn't mean that they won't have this need again tomorrow, but for this moment on this day, their need has been met. And then you click Save and Exit. Once you save and exit, it returns to your services preview pane, and you can see the service that you just entered. April 2nd, by the outreach team, food pantries, and of course, my HMIS trainer is the user that did it. Let's add another service for practice. I can click this Add Service button here to add another service, or I can click Back to Dashboard and use this button to add a service. Let's do another one. Let's say we also supplied them with some drinking water today. Save and continue. Do not need to fill out any of this data except for the very bottom of the page, where I need to change my need status to closed and my outcome to fully met. Please always mark your services as closed and fully met before you save and exit. And now I've recorded 2 services. The next thing I'm going to show you is, I'm going to go back to my dashboard, and I'm going to show you how to record multiple services. So we did 1 service, 1 client. Now I'm going to show you multiple service for 1 client. So let's change our day, and let's say back when we met with them on March 8th, we gave them a couple of things. So instead of recording each service individually, as long as they happened on the same day, you can use this option of adding multiple service. That means you gave more than 1 service on the same day to this particular client. So click Add Multiple Services. At the top, you have your provider and your date that you provided the service. And then you have your first service. What did you provide to them? Let's say we provided them where to go to get some free clothes. And then you put the need status is closed and fully met. But we also gave them something else that day. So instead of being done, we can click Add Another in the bottom right-hand corner, and we can do the next service that we provided. Let's say we also provided food on this day as well. So food pantry, closed, fully met. You can just keep going, add another, until you record everything that you helped this client with on this day. Once you're done, then you click Save and Exit. And now recorded, I have 2 services on 3/8 and 2 services on 4/2. Okay, let's go back to the client information page. And I'm going to show you next how to use ScanPoint. This is another way to record services. ScanPoint is a way that you can record a service for multiple clients all at the same time. So if in any given day you handed out, to more than 1 person, information or water bottles or food, something like that. And again, this is just an example. You could record that on all the clients at one time, and it saves you some time and some clicks in the system. So go to your menu on the left and click on ScanPoint. And the first demonstration I'm going to show you is how to record 1 service for multiple clients. You select your service provider. It should default. If it is not defaulted, that means you're not in Enter Data As mode, and you should cancel and get into EDA mode. Then you choose what is the service that you provided, and just for example today I'm just going to put food pantry, but it could be anything from your list. The day that it happened, I'm going to say that it happened today, so I'm not going to use my backdate mode, but if this did not happen today, you should use backdate. You can make any quick notes about this particular service, but keep in mind these notes would be attached to every single client that you're going to attach the service to, so it needs to be generic. And then I'm going to go down and I'm going to attach this service to multiple clients. And there's 2 options. Now down in the bottom right hand side of your screen, you're going to see 3 buttons. Start Scan, Choose Clients from a Client List, and Choose Clients from a Unit List. Outreach teams cannot use this 3rd option, Choose Clients from a Unit List, obviously, because you don't check clients into units. So outreach teams only have 2 options for how to attach this service to multiple clients. And I will show you both options. The first one is Start Scan. So click on the Start Scan button, and this is where you would look for the clients that received this particular service on this particular day in the system. You can search for clients either by their HMIS ID number, typing it into this box, or you can search for them by name. I'll show you both ways. So let's say the first client, I don't know their ID number, I just know their name. So I can do a search and choose them from the list with the green plus sign. But the rest of my clients that received food today, I know their ID numbers, and you can do it this way as well. So you can type in their client ID number here and click scan barcode to add them to the list. Or I can type in then their ID number and then just click enter on my keyboard, and this also will put them on the list. And I would continue to do this until every client that received this service on this day was listed below. And of course the client I'm working with today. Once you have everyone listed, you just click exit and you're done. You've recorded this service on this day for those 5 people. Now the second option, if you say you're encountering the same group of people over and over, you can use this choose client from client list, but this involves creating the client list ahead of time and having to maintain that list. So it's probably not something that's used by an outreach team very often, but I'm going to show you how to use it just in case. So since I know I need to create the list first and I haven't done that yet, that's what I'm going to show you next. So I'm going to scroll to the top and find the tab that says Manage Client Lists. And I'm going to create a new list of the clients that I work with on a regular basis. So I'm going to say Create a new client list. And the first thing it's going to ask me is to name the list. And you can name it whatever you like, but keep in mind that everyone at your agency will be able to see the list, so you want to be pretty specific. Save and continue. And then you choose, who do I want on this list? Which clients do I want listed? So I'm going to put the same clients in here. And again, you can just type in their client ID number. Whoops. And you can click Add New Client to List, or you can click Enter on your keyboard, or you can search for the client by name, just like we did before. So I can put Will Graham, search, and add him in. And then I exit the search and I'm back on building my client list here. And my client I'm working with today. So here's my client list. This can be as long as you want. Exit, and now I have my client list. Go back to provide service, and we're going to do another scenario. So let's say we also gave, I'm just going to use the water again, just a generic, for example, service that was done on this day. And this time, instead of start scan, I'm going to say choose my clients from a pre-existing client list. So I say click that button, and then all the lists that are available to me, all the lists that have been created by my agency, come up. I choose the list I want to work with. This is my list I just created, and there's their names. And at this point, I can just check mark the names of the people that got the service that day. If there were a few that are usually there, but they weren't there today, I don't have to check mark their names, and then it won't record the service for them. Or if everyone was there, I can just say check all and save myself some clicks. Once you have check marked who actually received the service, and again, it doesn't have to be everybody, click enter service for clients and you'll get this little confirmation. Now I'm going to show you how to record multiple services for multiple clients. So click on the multiple services tab. Ensure your provider is correct and the date. And what's the first service I provided? Again, I'm just going to use these generic for training today. And the service is closed and fully met. But I also provided water. And it was closed and fully met. And I could just do add another, add another, add another. And then I can do my start scan or choose clients from list again to say these 2 people got multiple services all on the same day, enter service for clients. And let's go back to our Home tab. The last thing I'm going to show you today is those services that we just recorded through ScanPoint and where you would go to make a correction if you needed to. So let's look up our client again by clicking on Client Point on the menu and searching for our outreach client and choosing them from the client results. And I'm going to go to the Service Transactions tab. And this time I'm going to choose View Entire Service History. I want to see everything that's happened. And you can see all these services that we recorded on 6/7/2015 through the ScanPoint module. See, it works great. But let's say you made a mistake. If you make a mistake and you accidentally record a service, say on the wrong client or on the wrong day, or you recorded it twice on the same day and you didn't need to. So let's say, for instance, I did this on purpose for training, but let's say I went back and I realized, oh no, I recorded food and water on the same day twice for this client, and I need to get rid of one set. First of all, take notice that every single service has two lines. It has the need, they had a need for water, and then it has the service that you provided it. So we need to be sure when we're making corrections and deleting something that shouldn't have been there, that we're deleting both lines. The quickest way to do that is to delete the need. If you delete the need, it automatically deletes the service. If you forget, well, let's do this first. If you delete the need, it deletes the service. Boom, both lines are gone. If, however, you forget and you delete the service first, that's okay. Just go back, see now there's a need all alone, and delete the need as well. If you have a very complicated situation going on, or you're not sure what needs to be corrected, maybe you just need to correct the day but not the actual service, whatever the case is, if you're not comfortable making those corrections, please feel free to call us at the HMIS Help Desk, and I will give you that email and phone number again at the end of the training.
Now, let's take a moment to look over this summary. There are a few key points we would like you to keep in mind. According to the Maricopa HMIS Data Quality Plan, you must enter clients into the system within 5 business days. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. When creating an entry at first contact with your client, you must go through the Entry Exit tab. The first contact date and location must be recorded within the Outreach Sub-Assessment at the bottom of the Outreach Universal Contact Assessment. At least one service should be recorded at each contact. Client demographic information should be gathered as it becomes available, and it should always be recorded in the Entry Exit tab through the Outreach Universal Contact and Outreach Universal Engagement Assessments. Outreach teams are not held to the Continuum Data Quality Plan on completeness until the client becomes engaged, but all data gathered should be filled in and updated as much as possible until then. HUD considers the zip code of last permanent address to be where the client was housed for at least 90 days or more. Now, we need you to remember these next few points when completing the length of time on streets in an emergency shelter or safe haven section. You will only answer yes to the first question when the client is entering your project directly from the streets, an emergency shelter, or a safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. For example, if their entry date to your project is October 3rd of 2015,
but they only remembered their last episode of homelessness starting in May sometime, then you can put a start date as of May 3rd, 2015. Count the number of times a client has been homeless in the past 3 years, even if they're not entering your project directly from the streets, emergency shelter, or safe haven. Only use never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. Add up the accumulated months of homelessness during the past 3 years, where the client was either living in the streets, in an emergency shelter, or a safe haven. Any single day or part of a month counts as one full month for this question. Each subsequent contact date and location must be recorded in HMIS via interim updates. Interim is located on the Entry/Exit tab. The Outreach Universal Contact Assessment defaults, which has the Outreach Sub-Assessment at the bottom. Again, at least one service should be recorded at each contact. When wanting to record a service to a client's profile, you will do so on the Service Transactions tab. When adding a service, the start and end date should auto-populate, but make sure they are both complete. Do not leave the dates blank. The need status of a service should always be set to closed, and the outcome of a service should always be set to fully met. When wanting to record services or multiple services to multiple clients at once, you will use the ScanPoint module. When using the ScanPoint module, there are only 2 options out of the total 3 that can be used by outreach projects. Option number 1, Start Scan. This is where you can search for your client by name and social security number or by their HMIS client ID number. Option number 2, you will choose clients from a client list. But first, you must create a client list through the Manage Clients List tab. Then you can apply the service or services to that specific list of clients. The unit list option is the third option, which cannot be used by outreach project. When wanting to review or make corrections on existing services, you will go to your client's profile and locate the Service Transactions tab. From there, you will click on the View Entire Service History button. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you so much, and please refer back to your training confirmation email for further instructions.